morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. Affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of my health talk today is walking pneumonia in children as well as adolescent and adult, but here I'm just emphasizing my facts on in children. Also the role of RSV vaccine. And I just wanted to let you know from the beginning, before I start with my slide presentation, this persistent cold, cough, walk-in bronchitis, bronchial pneumonia, all those things start since the beginning of November. From the beginning of November, even end of October till now, the symptoms linger. There is a combination of RSV virus, a combination of other mycobacteria. So those are the facts that lead us to talk more about the pneumonia and also emphasize on the RSV vaccines along with it. So what is walking pneumonia? It is a mild form of pneumonia. It is caused by the Mycoplasma pneumonia. There are other kinds of bacteria, as you can see on my slide presentation, like atypical mycobacteria, like chlamydia, but those are the major cause of causing symptoms in our children, and along with the presence of RSV virus, which is called the respiratory syncytial virus. They aggravate the symptoms of respiratory infection in the children, particularly those under 2 years of age. They are the ones who really suffer from the serious infection, including severe pneumonia. So in this slide presentation, I'm going to examine the walking pneumonia in children, its symptoms, diagnosis, its correlation with the RSV virus, and also the treatment rendered. Next slide, please. So understanding the walking pneumonia in the children, it is an atypical pneumonia. The sense it is atypical is the fact that these patients, they are not that sick to be admitted to the hospital. They continuously have symptoms of cold, cough, sneezing, and productive cough. However, they are not that serious to be admitted at the hospital like any other cause of bacterial pneumonia, which is streptococcal pneumonia in children. Next slide, please. So what are the causes? It is very important to find out the causes before the treatment is rendered. So mostly it is a Mycoplasma pneumonia. It is a slow-growing virus. It doesn't have a cell wall, and it settles right to the lungs, to the bronchi and the alveoli. Common in children, and especially the presence of this Mycoplasma pneumonia, along with if the children have susceptible to the RSV virus, which is a virus that they suffer from, that together itself brings a lot of complications and the causes. Next slide, please. So what are the symptoms of this walking pneumonia? Like I mentioned before, these kids are halfway decent. They are not very sick. They usually have fatigue, lethargy, they have a low-grade fever, not enough to be suspicious of bacterial pneumonia. Of course, sore throat, chills, and the body aches. They have a lot of nasal congestions and chest discomfort. The condition is referred as walking pneumonia is referred because the affected children, they are able to continue with the normal activity throughout their infection phase. They may appear very fatigued and tired. Next slide. So briefly, I have described the slide shows in a child fatigue, irritability, cough, bluish lip on the nails, and rapid or difficult breathing. These are mostly the signs of walking pneumonia. Next slide. So diagnosis and treatment. The diagnosis of this condition is mostly from the history. Take a thorough history of the child when they come to the urgent care or emergency room, a good physical examination, and definitely rule out the other conditions of respiratory distress, such as, the tonsillar area, peritonsillar abscess, all this. A chest X-ray will confirm the diagnosis if the symptoms persist. Normally, a chest X-ray is not needed. It is a clinical diagnosis. However, persistence of symptom necessitates a chest X-ray in order to confirm the diagnosis. And like I said before, this mycoplasma pneumonia, it does not have a cell wall. So when there is a consideration of what antibiotics to be used, it does not respond to the beta-lactam antibodies like penicillin. Instead, the macrolides, azithromycin or clarithromycin, those are the antibiotics of choice. Besides the antibiotics, adequate hydration, rest, nutrition, and over-the-counter fever-reducing medicine, such as Tylenol or ibuprofen. Most children recover fully within 1 to 2 weeks of the infection. After 2 weeks, the cough might persist, but they are better. So now, next slide, please. Talking about the RSV, which is respiratory syncytial virus and relationship to pneumonia. So what is RSV? Respiratory syncytial virus, it is a major viral pathogen that can cause lower respiratory infection in young children. RSV is highly contagious. All the children, even under the age of 2, when they suffer from the RSV virus, they have a lot of clinical symptoms. The infant and the children who have compromised immune system, this RSV virus, once it is there in the lungs, can cause to a severe bronchiolitis, pneumonia, which is a serious condition, and that needs hospital admission. What is the RSV role in complicating? While RSV by itself is a viral infection, what it does, it weakens the respiratory system, and the lungs are more susceptible to other bacterial infection. So walking pneumonia due to atypical mycobacteria, once it is combined with RSV virus, which is a virus, the symptoms get worse because both of them, virus and the mycobacteria, both of them, they affect the lungs, the alveoli. The alveoli gets filled up with the mucus secretions, and the cough, they are unable to cough out. So now I'm going to talk about the role of RSV vaccine, which is very, very important. The RSV vaccine plays a major significant role in controlling the symptoms of the bacteria, symptoms of the pneumonia. And also reduces the respiratory infection. Until recently, there was no effective vaccine to protect against RSV. However, there has been a lot of advancement in the immunology, and that has led to the development of RSV vaccine that is for the susceptible individuals. That includes young kids and also the older adult. But what is the mechanism and importance of the vaccine? What does the vaccine do? The vaccine works by stimulating the immune system. The immune system to recognize and neutralize the virus before it can cause severe infection. For children, the vaccines are also available with the monoclonal antibodies. Monoclonal antibodies have proved an important role in maternal immunization. In the pregnant women, they can receive the vaccine during their third trimester of pregnancy. That reduces the risk of RSV virus in infants, especially during the vulnerable months like winter, late winter, spring months. Monoclonal antibody therapy, pulvinized, and the newer ones are monoclonal antibodies, and that what do they do? It is not active. It produces a passive immunity in the high-risk infants, such as preterm babies or those with the underlying condition. By preventing the RSV infection, these vaccines, they help mitigate the risk of secondary bacterial infection. Like they fight against the bacteria, so there is less serious bacterial infection like walking pneumonia. This is very crucial, especially in the children, where respiratory tract infections are so common. So here is a slide that I have prepared for the three major conditions during winter: COVID-19 and flu vaccines. Everyone 6 months and later should get this vaccine. RSV immunization to protect the babies, especially during also pregnancy during the RSV season. Baby entering or born during the RSV season. And the third is the RSV vaccine for the older people, that everybody aged 65 or 75 older should receive both the RSV vaccine along with the flu vaccine. So what are the benefits of RSV vaccine in reducing the pneumonia? The RSV vaccine, what does it do? It reduces the burden of the walking pneumonia. How does it do that? It lowers the RSV-associated lung damage, like the mucosa of the lungs that had been previously previously damaged by the virus or the bacteria. It prevents the RSV infection, reduces the inflammation and damage to the lungs. It decreases the hospitalization rate, which is very important because these patients, adult child, they are frequently visiting the hospital for the same symptoms. With the combination of this vaccination along with the normal vaccine, it helps in improving the respiratory tract infection and enables a quick recovery from the walking pneumonia. So what are the challenges and future direction? Very important to learn. Despite its promise, the RSV vaccination program, it faces a challenge, including the cost, accessibility, and vaccine hesitancy. Additionally, not all children are able to get it because of the cost issue, because some of the issue about not getting the vaccination. But high-risk infants should definitely be receiving it. So now expanding the vaccination access to all the children, further research in combination vaccines target both the viral and the bacterial respiratory pathogens because it improves the outcome. Looking ahead, what are we looking at the future? The integrated strategies, routine RSV immunization, widespread antibiotics availability for the bacterial pneumonia, and they together potentially reduce the respiratory infections in the children. So what is the conclusion? The walking pneumonia, though still mild, it can lead to prolonged symptoms, especially when it is combined with the viral infection like the RSV. So what is the keynote? The RSV vaccine, they play a critical role in preventing a severe respiratory infection. Thereby, indirectly, it reduces the risk and severity of walking pneumonia by protecting the pediatric population against this serious illness of the respiratory tract infection. We are preventing their frequent admission to the hospital for treatment of the worst conditions. As immunization strategies evolve, the combination of preventive measures and the effective treatment will play a significant key role in addressing walking pneumonia and other respiratory tract illness. At the end of my talk, these are the bibliography that I have used for how there are more bibliography, but these are the mostly that I studied, plus from my clinical experience working at the emergency room, urgent care for all these years of my life, I prepared this script. I really thank my occupational health and safety nurse Melanie Lynch, she helped me so much in preparing my slides. And at the end, disclaimer, I always advise everybody, whoever suffer and whoever sees my slide presentation, these are just my own views. I advise all of them, all the viewers, to always check with their primary care physician for more advice and more treatment. At the end, I'd like to thank our producer. I like to thank our camera people. I like to thank Melanie Len, all these people who helped me preparing this wonderful slide presentation. Until I see you all again, I want all of you to have a very safe winter and spring month. Thank you again.